My name is Justin Bell, and I'm the Vice President of Health Strategies for the American Heart Association, and I work out of the Twin Cities office right here in Minnesota. I'm very excited to be moderating the American Heart Association's Heart Month Wellness Hour with 3 local experts that'll discuss heart healthy habits, including blood pressure control, healthy eating, physical activity, and quality sleep. Once we finish tonight, an email link will be sent out to everyone with resources that'll follow up to the webinar that'll have extra information and extra links that you can use for further resources after our presentation tonight. So let me get started by introducing our panelists. Dr. Peter Ekman is a cardiologist with the Minneapolis Heart Institute at Abbott Northwestern Hospital. Dr. Ekman has published dozens of scientific papers and is a section editor for the American Society of Artificial Internal Organs Journal. He's currently serving as the Twin Cities board president for the American Heart Association. Dr. LaPrincess Brewer is a cardiologist and assistant professor of medicine at the Mayo Clinic College of Medicine within the Department of Cardiovascular Medicine. Her research focuses on addressing cardiovascular health disparities through innovative community-based behavioral interventions for cardiovascular disease risk factor modification in underserved communities and special populations. And finally, Dr. John Park is an associate professor of medicine in the Department of Pulmonary and Critical Care Medicine at the Mayo Clinic. He is a nationally and internationally known expert speaker whose research has focused on obstructive sleep apnea, delirium, and quality and safety improvements. So to get us started tonight, Dr. Ekman will discuss what blood pressure is and what you can do to prevent or control high blood pressure and why that's important to your health.
Blood pressure is a critical factor in heart health and heart and vascular health. First, in terms of definition, when we talk about blood pressure, it's usually described as a systolic or top number and a diastolic blood pressure or bottom number. High blood pressure is defined as a systolic pressure over 130 or a diastolic greater than 80, or if you are on antihypertensive medications. This is an incredibly common problem. Over 120 million Americans have this, over half of males and 43% of women. And it increases pretty dramatically with age from anywhere from 12 to 30% in the 20 to 34 age group to almost 85% of patients who are 75 years of age and older. A lot of these statistics today are from the American Heart Association's 2021 update on heart and stroke statistics, which were actually published online, but will be published in print in the next week or so. High blood pressure is a problem that many adults are unaware they have this problem. And it's also incredibly common in Black Americans. The lifetime risk, as I said, is very high. And so this is a problem that touches most people at some point in your life. Next slide, please. The American Heart Association has examples of categories and severity. A normal blood pressure would be a systolic less than 120 and a diastolic less than 80. Even above that is considered elevated, although typically is characterized as hypertensive if your systolic is greater than 130 or diastolic greater than 80. Stage 2 and stage 3 are when these pressures are much higher. And if you have a systolic greater than 180 or a diastolic greater than 120, this is something that could be evidence of a hypertensive crisis and should be addressed as soon as possible. Next slide, please. Fortunately, there's a number of ways for people to monitor at home. This was just a quick Google search of home monitoring options for blood pressure cuffs. There's no one particular one that I would recommend. They all have various features. Some are designed to take wrist pressures, some take brachial pressures, which is the upper part of your arm. There's different features in terms of wireless connectivity, and there are cuffs that serve a range of budgets, ranging from, as this quick example here, anywhere from $25 up to almost $400. So there's a number of options for people to take this and measure their blood pressure at home. Next slide, please. Why do we care about high blood pressure? This is a major risk factor for a number of critical medical problems that I think all of us would like to avoid. People with high blood pressure have triple the risk of stroke. It can increase the risk of vision loss. High blood pressure can cause damage to the small capillaries and blood vessels in your eyes. It's been long associated with heart attacks and doubles your risk of heart failure. It has also been proven to be a major factor in kidney disease and progression to kidney failure, and has been implicated in sexual dysfunction. Studies suggest that for every 10 millimeter of mercury increase in your blood pressure, your risk of dying increases by 15%. And if we were to able to, excuse me, eliminate high blood pressure, it's expected that this would reduce the number of cases of cardiovascular mortality by about 1 in 3. So this is a huge attributable risk for many of these major problems, including those that can be life-threatening. Next slide, please. What does high blood pressure do to your heart? This is an example. On the left is a heart that has been exposed to high blood pressure. And this is kind of looking down the barrel of the heart as if you were a blood cell about to leave the heart. There's kind of that circle, almost looks like a donut there. That's the left ventricle. That's what pumps blood to the body. And if your heart has to pump against high blood pressure, it's a muscle, and we describe this as hypertrophy or get thicker. In contrast, you can see the heart on the right. It's still somewhat thick because this is a heart that does have to pump blood to the whole body, but it's not quite as thick. And as you can imagine, I always like to give people the example of, weightlifters may have real thick, well-developed muscles, but you don't typically see them out doing gymnastics, and they often are not very flexible. And so this type of hypertensive heart disease, that heart might squeeze very well, but it doesn't necessarily relax well. And the relaxation or diastole is an essential part of the cardiac cycle. You can also, I think, appreciate on these slides that the right ventricle is much thinner, and that's because it pumps against much lower blood pressure that's present in the lungs. Next slide, please. What are some of the risk factors for high blood pressure? Just to call out a few, a Norwegian study showed a significant risk of up to 30% within 10 years of women that had complications of pregnancy, such as preeclampsia or gestational diabetes. There are also a number of social determinants, such as lower socioeconomic status measured by income, occupation, and folks with a lower level of education are almost twice as likely to have high blood pressure. And this is also an example of sort of the structural remnants of housing policies and, quite frankly, racism over the years, that census tracts that are more segregated have been shown to have populations with an increased rate of high blood pressure over a 25-year period. And neighborhoods that are rated more safely also have a lower systolic blood pressure. Next slide, please. In terms of treatment, some of the things that we recommend are sodium restriction, also known as SALT. Each 1,000 milligrams of additional intake has been associated with about a 5 millimeter mercury higher systolic and 2 millimeter higher diastolic blood pressure. We also know that vigorous physical activity is an important risk factor, and intermediate activity on a regular basis can cut your risk of developing this by almost a quarter. We know that patients with moderate or severe sleep apnea also have a significantly increased risk of hypertension. Obesity increases your risk of hypertension, and weight loss can be helpful. Even at the level of losing 5 to 10 pounds can help reduce blood pressure. Fortunately, there are a number of medications that are available to help treat this problem, many of which can be very affordable. I should also note that high blood pressure often does tend to run in the family, and unfortunately, you can't choose your parents, so there's not much we can do about the genetic components of it. Next slide, please. This is just an example of some of the medication options from one of my partners who had presented on this recently, and came up with a reasonably comprehensive list of all the medications that could be used for treating high blood pressure. Don't worry, there won't be a test on this, but I give this as an example just to show. In yellow are the different classes of medications, which work by different mechanisms or on different receptors in your body. And within each class or category, there are a number of different options. This is important to point out because treating high blood pressure can be a challenge. It is typically an asymptomatic problem until the late stages. And so sometimes as a doctor, it's hard to convince people to take pills that may have side effects that make them feel worse to reduce the risk of long-term problems. In most cases, if you're having side effects or problems from your blood pressure medication, there may be, and almost certainly is based on this description here, other medications or other classes that might be a better fit for you and your body. We should also mention a technology that's being tested. There was a study done back in the 1950s where surgical nerve treatment of nerves that went to the kidney and some of the structures around the kidney were damaged or destroyed, and discovered that that led to dramatic decreases in blood pressure. There are currently a number of trials and studies looking at whether we might be able to use catheters to damage or alter how these nerves function, because the nerves that affect the kidneys and are in that region of your body appear to have a substantial impact on how your blood pressure develops. So that's something that may be a future option. It's certainly not standard of care, but is being tested in a number of clinical trials. So a lot of options for treatment of blood pressure. I would be remiss if I didn't also mention, as I alluded to, exercise and weight loss can be helpful, and treatment of sleep apnea, for example, can lead to dramatic reductions in blood pressure. And I have a family member that was on 5 different medications for high blood pressure, was discovered to have sleep apnea, began treatment, and was able to come off all medications. Next slide, please. There's a number of myths that I want to just mention. People often will say, well, it runs in my family, there's nothing I can do to prevent it. Well, like I said, you can't prevent your parents, but if it runs in your family, being diligent about checking and monitoring for this, and some of the things that we talked about, such as reducing sodium intake and exercise and maintaining a healthy weight, certainly can reduce your risk, or if nothing else, delay the onset of when this happens. Another thing that I often hear is, well, I don't add salt. I don't have a salt shaker. That's helpful, but most of the sodium intake in people's diet comes from sodium that's already in the foods. For example, such as most processed and packaged foods have a lot of sodium in them. The other thing, if people feel fine, they assume that their blood pressure they must be fine. And as I said, it is often asymptomatic. Another thing that we often hear is that wine is good for the heart, so I should drink as much as I want, and that's certainly not true. We don't think that there's a dramatic danger to low levels of intake, but it does not fall into the if some is good, more is better category, and moderate alcohol intake at most is what's generally recommended. But it's not clear that increasing your red wine intake is going to decrease your blood pressure, and I certainly wouldn't recommend it. Another thing we often hear is, well, once someone's on medication, their blood pressure gets lower, well, then you can stop your medication. To me, this, I think, reminds me of a famous quote from a former Supreme Court Justice, Ruth Bader Ginsburg. It's kind of like saying, if you have an umbrella, you're not getting wet, even if it's raining. Can I put away my umbrella? I think it's somewhat akin to that if your blood pressure is good, it's because you're on medication in many cases. Next slide, please. Just a couple of links here. One is from the American Heart Association website that has some more information on blood pressure and some of the factors we talked about here today. And then I also wanted to give the reference for the detailed technical update, which is where I got a number of these up to the moment statistics. Like I said, it's even a glimpse from the future, because this will be published later this month, although it is available online. So I appreciate the invitation to present and speak with you today about high blood pressure.
Thanks so much, Dr. Ekman, for all that great information. And you'll stick around and answer some questions at the end, I'm sure. So thank you again. Next, we'd like to invite Dr. LaPrincess Brewer to discuss the connections between heart health and additional factors such as healthy eating and physical activity. So thanks for being here tonight, Dr. Brewer.
Awesome. Thank you so much for this opportunity to speak on this topic that is really near and dear to my heart as a cardiologist and scientist. And in the spirit of American Heart Month, I really would like to encourage us all by providing steps on living better with the Life Simple 7. Next slide, please. Let's take a journey together towards heart health. Wouldn't it be amazing if you had a guide that would help to prevent heart disease and stroke, and also help you feel better? and stronger and healthier starting right now? What if you had a roadmap that would improve your quality of life and give you the energy and time to invest in your life goals? The good news is that we do have a guide. Next slide. The American Heart Association has now shifted its focus, if you will, to a health impact goal to improve the heart health of all Americans by 20% while reducing deaths from heart disease and stroke by 20%. That's a huge goal. So how can the AHA possibly achieve this goal? So the answer is by helping people identify and adopt healthier lifestyle choices. So for the first time, the AHA has defined what we call ideal or the best heart health. And they've identified 7 health factors and lifestyle behaviors that support heart health. And we call these the wonderful Life Simple 7. So improvements in these 7 simple action steps can greatly impact your quality of life and lifespan. So throughout the rest of my talk, we will continue on our journey together on each of these 7 steps. So one of my favorite quotes from Reverend Dr. Martin Luther King is that faith is taking the first step even when you can't see the whole staircase. So this is great motivation for us all to take the first step towards living a long, productive, and healthy life. Next slide, please. So as I've said, we've simplified for you healthy living down to 7 health factors and lifestyle behaviors to measure and track. And these are the 7 most important things you can do to live a healthy life free from heart disease and stroke. So the AHA developed an online assessment tool called My Life Check, which is pictured here, that outlines the 7 goals for ideal heart health. And it shows you where you are on the path and where you need to improve, and offers simple action steps you can take to reach your goals. And we'll make sure to share this link with you. So I encourage everyone joining us to visit the AHA website, use the My Life Check tool, check your heart score to help you understand what simple steps you may need to take to improve your heart health and quality of life. So that's your homework. So what are the 7 simple steps, you may ask? So without further delay, let's look at each one more closely. So we had a wonderful talk about hypertension. So this is definitely one of the Life Simple 7. So managing your blood pressure. So hypertension or high blood pressure is the single most significant risk factor for heart disease. And it's sometimes called the silent killer because it has no symptoms. And 1 in 3 adults has high blood pressure, yet only about 20% even know that they have it. So I also want to note that African Americans have the highest high blood pressure rates in the world. So I'll repeat that. African Americans have the highest high blood pressure rates in the world. So if you're ready to embrace a life free from heart disease and stroke, one of your best strategies is to keep your blood pressure numbers in the normal or excellent range. So how? We really need to know your numbers and never judge your blood pressure, again, by how you feel or your best guess. High blood pressure has no symptoms until obvious symptoms until there's serious damage well underway. So I also recommend getting a blood pressure monitor. And no one can afford to ignore blood pressure. So learn healthy habits for eating well and also stay active to manage your blood pressure. So next slide. So as a segue, so let's get active. So the evidence is clear that people who exercise have better health than those who do not. So fewer than 2, I'll say that again, 2 out of every 10 Americans get the recommended 150 minutes or more of moderate physical activity each week. So you're not alone. So now if you score less than excellent in physical activity, I've got good news for you. If you can put one foot in front of the other, you can improve your score, guaranteed. It's very simple. Let's just all get moving. So first, make your decision. Tell yourself, no excuses, get moving. Engage in moderate physical activity like brisk walking, at least 30 minutes a day for at least 5 times a week. So just like eating, sleeping, brushing your teeth, physical activity is one of life's basics, so it must be done. And I'm not asking you all to train for a marathon either. But what is the best exercise program to start, you may ask? The answer is the one that you can stick with. Choose activities you enjoy. A walking program really has been shown to be the best exercise as far as success rates of people sticking with it. And you can also break your exercise sessions up to into 2 to 3 sessions of 10 minutes each, if that works best for you and your schedule. But the point is, getting regular physical activity can improve your overall heart health, and it makes you feel good about yourself. So next slide, please. So let's talk about controlling cholesterol. So let's be clear about what cholesterol is and why it's important to reach your health goals. So everyone has cholesterol. It's the waxy substance in your bloodstream and cells. And some cholesterol is important for good health, but too much cholesterol in the blood puts you at major risk for heart disease and stroke. So when too much LDL, or bad or lousy, I like to have my patients remember it that way, cholesterol, circulates in the blood, it can slowly build up inside the walls of your arteries that feed your heart and your brain. And these cholesterol particles can then lodge into your artery walls and just get stuck there. And then cholesterol combines with other substances in your blood to form a plaque. And then you get this thick, hard deposit that can narrow the arteries, and it makes them less flexible. And that puts you at risk for heart disease and stroke. So remember, you want your blood to be able to go with the flow. So keep your cholesterol low. I thought that was fun. So how do you control cholesterol? First, follow your healthcare provider's advice, which will likely include, eating healthy foods, getting active, and you can never be too busy to exercise. And again, make physical activity a habit. All right, next slide, please. So eating better. So your body is counting on you to choose a wide variety of foods that are high in nutrition, fiber, low cholesterol, fat. And if you were to write down every single bite that you put into your mouth today, what do you think you would learn about your own nutrition habits? So I really encourage you to say yes to choosing foods like, lots of fruits and vegetables, whole grain carbs, fat-free or low-fat dairy products, and also regularly include fish that is rich in omega-3s. And these are great for both your heart and your brain. And say no to foods and drinks with added sugar and high sodium. And these guidelines are important for your whole family, and everyone in your house will benefit from eating this way. So just make it a family affair, if you will. Next slide. All right, so maintaining a healthy weight. So if you're overweight, don't waste your energy feeling guilty or bad about it. Instead, do something positive. Knowing your BMI is key. BMI is the height to weight comparison that helps you identify if you are in the healthy weight target for your height. So if your BMI is higher than 25, you should really work to bring that number down. Weight loss is best achieved over time and, with commitment to many of the things I've already talked about. So losing weight means changing the balance of calories in to calories out. So if we eat more calories than we need, we gain weight. If we eat fewer calories than we use, we actually lose weight. So how do you reduce the number of calories you take in? You need to plan your eating choices and stick with your plan. And when you get tired and hungry, you're more likely to stop for fast food. We've all been there, or snack on junk food. Plan healthy meals and snacks to help break that habit. And also be sure to read food labels and avoid foods that are high in sugar, saturated fat, trans fat, calories, sodium. And remember, there are two sides to the weight loss equation, right? So you need to increase the calories you burn. And then I'm going to say it again, regular physical activity, even 30 minutes a day, is essential. So besides helping you lose weight, physical activity can also help you to maintain a healthy weight. All right, next slide, please. All right, so don't smoke. Even if you smoke for years, your body can start to repair the process as soon as you stop harming it with more smoke. So if you're ready to start, your plan to quit, it's a good idea to talk to your healthcare provider. Medication combined with behavioral therapies also increases your chance of success. But with or without a prescription, here's a good plan to improve your chances for success. So first, focus on the rewards. It's a lot more satisfying to make changes when you focus on positive rewards, right? And you'll experience this by tossing out those cigarettes. You'll just think of the money you'll save, the benefits to your health, and the satisfaction of conquering those cravings to smoke. And then second, plan your response to roadblocks. You're gonna have them. So the hardest part is usually in the first couple of weeks, but make a plan on how you'll distract yourself during those first few weeks, and remind yourself that this difficulty is temporary. So the craving to smoke will not last forever. But once you get over that part, you're well on your way to quitting totally. So next slide, please. Lastly, reduce your blood sugar. So high blood sugar often happens when you maintain a diet with too many simple carbohydrates like sweets, donuts, white breads, cakes, cookies, pies, which are very quickly converted into glucose. And this can lead to the plaque buildup in your arteries. And while this is bad on its own, problems can become worse when your body gets resistant to insulin, or you stop making insulin altogether. So this condition is better known as diabetes. It's treatable, but can be very dangerous if it's not controlled. And it can also increase your risk for heart disease and stroke. And even if you don't have diabetes, you need to know your blood sugar level. And if your blood sugar level is higher than ideal, first, make good food choices. Again, choose the good balance of the nutritious foods. And you really want to focus on foods that take time to convert to glucose. So like whole grains, fruits and vegetables, not those that quickly convert. Second, commit to physical activity. Physical activity breaks down those carbs quicker and lowers your sugars. And then lastly, make sure you maintain a healthy weight, as this will help to keep your blood sugars under control. Next slide. So remember, the Life Simple 7 work together to help you build a better and stronger life. So by investing and improving in one area, like your activity levels, you're likely to improve on your other Life Simple 7, so your weight and your blood pressure too. So however, without a plan, you'll be at increased risk of heart disease and stroke and other illnesses and disabilities. And you may see an increased need for things that we don't want to have, surgeries and other medical treatments. And you'll almost certainly face a diminished quality of life. So next slide, please. But to end on a positive note, with the Life Simple 7, you can know you're taking care of yourself to reach your best health potential for yourself and for those you love. So together, we're building a healthier future, one heart at a time. So let's plan for many years of living well. And I hope you'll join me in taking the Life Simple 7 to heart health. Next slide. Thank you so much. And please follow me on Twitter. Remember, go red for women this month. Thank you so much.
Thank you so much, Dr. Brewer. We're really happy to have you here tonight, and we're hopeful that you'll hang out and answer some questions at the end. All right. And finally, we'd like to invite Dr. Park to discuss the role sleep can play in our mental health and our overall health and well-being. Welcome, Dr. Park.
Thank you very much. Let me share my slides. Again, I want to thank the organizers for the opportunity to speak to you about sleeping and the importance of sleep. And to kind of piggyback off what Dr. Brewer's excellent presentation. And since you're joining us tonight, I thought we'd give you a little bonus and talk about the Life Simple 7 Plus. And I put that plus because I think sleep is an important part of your overall health as well as the heart health. So I just threw that in for your benefit. So over the next 15 minutes or so, we'll just talk about what good sleep, what a normal sleep is like and why good sleep is so important. We'll talk about some disorders and habits that'll potentially rob you of your good night's sleep. And then we'll finish off with some, hopefully, recognizing some of those bad habits and what you can do to try to help improve your sleep overall. And I wanted to take a moment first to, again, talk about what a normal sleep is like. And we recognize that through our ages, our sleep the amount of sleep that we feel we need to be able to fully function is somewhat variable, but it is a wide range. And so you'll notice in the kind of the young adult, and this is a survey done by the National Sleep Foundation over thousands of people. And what they recognize is that there are individuals, young adults and adults, who feel like they can function perfectly well on 4 to 5 hours of sleep. And then yet there are individuals who feel like they need 10 to 12 hours of sleep. You'll notice that our younger adults feel like they need a little, there's a wider range. And as we get a little older, that range seems to get a little bit more narrow. And the reason I emphasize this range and what kind of the normative value would be is that sometimes I find that this is causes a little bit of conflict in the family. One spouse might feel like, oh, you're only sleeping 6 hours, that's bad, you need to spend more time in bed. Whereas another spouse might sleep 10 hours in bed and the other spouse is saying, why are you sleeping so much? You're lazy and you need to move on and do things. And so just to recognize that all of us have different needs and what we need to fully function. That said, unfortunately, one of the most common reasons that many of us feel sleepy is just because we get less sleep. We're busy with things and whatever else is, and other things I'll talk about in a little bit that will rob us of our good night's sleep. But recognizing that the reason most of us are sleepy is because most of us don't get enough sleep. So again, two things to emphasize is that there's a range of sleep that's considered normal, and whatever sleep you're getting, if you feel fully awake, fully functional, not feeling sleepy, then that's okay for you. But if you're getting whatever sleep you think you need, but you're feeling sleepy, one thing to consider might be that you're shortchanging your sleep. The other clue to that, when you feel like when you're shortchanging sleep, the other clue is maybe on weekends and holidays, you find that you're having to sleep more and catch up on your sleep. That might suggest that during the week or otherwise, you're actually shortchanging sleep. Sleep is actually also cumulative. The sleep debt is cumulative, meaning if you're an hour short of sleep every day, at the end of the week, you're 7 hours short. That's a full night's sleep for some people. So recognize that sleep debt, meaning shortchanging your requirement of sleep, can be cumulative over time. The other thing I wanted to emphasize about sleep is that it turns out our sleep actually develops and changes its degree and proportions of different types of sleep as we go through the night. This is what we call a hypnogram, which helps us this points to different stages of sleep that we go through the night. And to orient you, this W, this bar up here means you're awake. The second bar looking at R represents REM or dream sleep. That's the black bar. And then it's stage 1, stage 2, and stage 3 sleep. Stage 1 and 2 are considered lighter sleep, and then stage 3 is considered deep sleep. So what you'll notice is that we get more of the deep sleep in the first part of the night, and then our dream sleep, we get that more in the second half of the night. And the reason I want to emphasize this is that that's why it's actually better to try to sleep in one continuous phase that most folks will sleep during the late night to the morning hours versus trying to break up your sleep into different segments. Unfortunately, some of us who do shift work, it's hard to do this in a single block. But if you can, to the best of your ability, it would be preferred to try to sleep in a continuous block as best you can. And when you find that you can't, then this is where you might need to talk to your doctor. The other thing I want to emphasize is this waking up. You'll notice these times that it hits that W bar throughout the course of the night. That's actually normal. You might find that sometimes in the middle of the night, you roll over, look at the clock, and go back to sleep. As long as you're able to get back to sleep okay, and as long as you're able to get the sufficient hours of sleep, it's okay to wake up once or twice, maybe go to the bathroom. And that's again, I want to emphasize that these brief awakenings, as long as you're able to get back to sleep, is a normal phenomenon. So then what is it about sleep and what happens if we don't get enough sleep? Multiple studies have done, and again, you've heard a lot about its cardiovascular effects. It turns out, if you think about it, most of us sleep 7 hours a night or so. And it turns out during that time, it's actually an opportunity for our heart and our brain to get some rest. When we look at sleep studies during the course of the night, a normal pattern for many folks is that the heart rate will slow slightly as you go through the night. And we'll talk about what other things in the the brain. But we know that if you're not sleeping well, again, you heard Dr. Ekman earlier talk about those individuals have certain sleep disorders called sleep apnea. We know that that's an independent risk factor for some heart issues, some irregular heart problems. So we know that it's poor sleep's impact on heart. But as you can imagine, if you're not sleeping well and you're tired and sleepy, it turns out how you think about things, how you process things, what your memory is like, all of those things can be affected. And you can also imagine if you're not sleeping well and you're tired, you tend to be more irritable. Some people might feel more depressed. Not that not sleeping well means you have depression, although there's some correlation. It's just you might just feel more down and sleep and more depressed. It's like, oh, other people my age, they seem to be doing fine. Why am I not able to do things or find joy in these? And some of it might just be because you're just not getting a good night's sleep. This is a study from the National Institute of Health and talking about how disrupted sleep leads to heart disease. And this is an animal study, but this is just to show you what a blood vessel looks like when they were sleeping well. And just simply not sleeping well, you start to notice that that blood vessel narrows. And this is what then leads to things like high blood pressure and strokes and heart attacks. And so this is just one of many multitude of studies that have correlated poor sleep with increasing heart disease. This is a fascinating study done by folks at Boston University. And what we're looking at here, this is an MRI, particular brain image of the brain. And what I'm going to play here is you'll notice this red and blue, this red and then this blue pulsations. It turns out we've recognized that one of the things that happens from our brain-wise is that there's some processing and some cleansing and elimination of things. If you take a step back and think about all the things that your brain processes during the course of the day, little signs, little noises, things that you've heard, things that you've read, things that you've seen, but your brain doesn't hold on to all of it, otherwise it'll just get overwhelmed. And it turns out during the night, some of that processing of what's important and what's not happens. But this study then also shows that it turns out this is kind of a image study that says that our brain actually gets this cleansing phenomenon. So brainwashing, if you will, not in the torture sense, but in the cleansing sense. And it turns out that some of these studies, other studies have shown that if you don't sleep well, you actually have these increased potential for these plaque buildups. And some of those have been correlated with things like Alzheimer's and so forth. So you can imagine where while you're sleeping, getting this cleansing process is so important for our brain health as well as our heart health, as we've already discussed. Other things, so it turns out there are some stomach issues, there are some hormonal issues. We know that many of our hormones fluctuate based on our circadian rhythms, so night and day cycles. There are other things that are kidney functions based on how well we sleep, and immune function. So especially relevant this time of the year, for example, a study looked at our response to flu vaccine. So they've taken a group of folks, one group of folks that said, okay, you sleep normally 7-8 hours. Another group of folks who said, okay, you only sleep 4 hours. They gave them all of the same vaccine and they tested the body's response to that vaccine. And it turns out those who slept well, they had much more robust response to that immunization than those who were sleep deprived. So we know that our immune system is important, and getting good night's sleep is important for our immune system. So, and now that we've talked about why good night is so important, let's think about what things can rob us of a good night's sleep. In this day and age where we're so connected with our electronic devices, television programs, and especially now where many folks have working from home and really not able to get out much, we find that these electronics can definitely rob us of our sleep. For some people, it's just that light, that bright light that we're exposed to can affect it, but just our brain processing, thinking, and these things just doesn't allow us to just rest and be able to get a good night's sleep. Many of the habits, caffeine, alcohol, and cigarette, again, emphasize the importance of quitting smoking. But some of these other things that we might do out of habit, or we might just picked up more now that we're less active and at home more, that these type of things we know can rob us of our sleep. Some people turns out they say, yep, I can drink a pot of coffee and I can go to sleep. And studies have shown clearly that is possible for some patients. But the interesting thing is when we look at their brainwave after they've had that pot of coffee, while they fall asleep fairly quickly, we find that there's a lot of these what we call arousals or more awakenings that our brain is just kind of stimulated. And it doesn't allow them to get the good quality sleep that they need. Alcohol is another example. Some folks say, oh, I drink a little sip of whatever at night and it just helps me relax and I can get to sleep. But again, it turns out after so many hours, the brain again tends to have more of these arousals or awakenings and contributes to disrupted sleep. Nicotine, for all the bad things we talked about, how it's important to quit smoking. But the other thing is this, the nicotine is this brain stimulant. And so we know that can also, it turns out, affect our sleep quality. So again, very important. And some people, unfortunately, as they sleep and then they wake up in the middle of the night, then they start to pick up those habits. While I'm awake, I'm going to go drink something, or I'm going to smoke my cigarette. It turns out those behaviors will then perpetuate that wakefulness. And so this is where it's so important when if you do wake up in the middle of the night, say you to go to the bathroom or whatever it might be, what you do during that time might unfortunately perpetuate that wakefulness. And so again, and perpetuate that timing of when you wake up, that it's important that we try to avoid those things. Napping. Again, many folks say, now I'm home, I'm doing work from home, I'm a little tired, I'm going to take a nap. Studies in nap has been a little bit controversial, but what most studies suggest is just short nap, 10, 15 minutes, may be okay. As we look at our own, what we call circadian rhythm, it turns out around that 1 to 3 o'clock, we get this little lull in our attentiveness. That's that old country's siesta that some countries still kind of follow. But that short nap might be okay, but if you go beyond 30 minutes, it turns out that will start to negatively impact your ability to sleep. The analogy that I talk to patients about is if you think about a pressure cooker, right? So you're trying to cook something in a pressure cooker, but if you keep lifting that lid, you're not going to develop that pressure. And it turns out our sleep is very similar. Our sleep, the longer we're awake, it turns out there's a chemical in our brain that builds over time. But if you take these naps, it turns out that chemical kind of gets washed away. And so you don't develop enough of this pressure for your body to want to go to sleep and stay asleep. And so if you keep taking these frequent or long naps, that can then potentially rob you of a good night's sleep. Irregular cycles, and very common with our younger population, but sometimes when things are busy and whatever it might be, but this is an irregular sleep schedule, sometimes going to bed at 8, sometimes going to bed at 4 and waking up at 6. And these irregularity of the sleeps of our schedule turns out can also affect our ability to go to sleep and stay asleep as our body's trying to figure out, wait, am I supposed to be awake? Am I supposed to be asleep? So it turns out that's also detrimental. But also recognizing that many of the medicines we use to treat various diseases and inhalers, some of these are stimulants and some of these can affect our sleep, but some of these can also make us feel sleepy. So if you take it during the day, it might contribute to you feeling more sleepy and groggy. Some of these things that you take in the evening might actually cause insomnia. So recognizing that many of the medications might contribute to that. So this might be one of the things where you might want to talk to your primary provider and go over your medication list to see if maybe some of those things might be contributing to poor sleep. So other things. So again, we've kind of talked about this thing called sleep apnea. That's when while you're sleeping, your muscles relax and your airway becomes blocked, so you can't breathe. Well, when that happens, at some point, your brain says, wake up, take a breath, and has this awakening or arousal that sometimes you might wake up with a snort, sometimes you might not, but that's interrupting your sleep and turns out it stresses your heart and brain. So having things, this loud snoring and stopping in your breathing while you're sleeping, turns out that's something to watch for. Recognizing that there are various sleep disorders like nightmare syndromes, and these things that causes issues, or some folks have insomnia that we need to then talk about and understand. Certain diseases like chronic cough, problems with urination, we know that these things can certainly contribute to those. Some people have what's called restless leg syndrome. That's that irritable sense, that urge that you got to move your legs and you can't control it, that sometimes can be activating and contribute to inability to sleep. I mentioned briefly about depression. We know, unfortunately, that those who are depressed, they tend to not sleep well and tend to have early morning awakenings. And then again, as I mentioned, if you don't sleep well, that can contribute to feeling more depressed. And so again, disorders like depression can be an issue, nightmare syndromes, especially for our younger children. But some of our older patients might start to act out dreams, and that can also affect not only the patient themselves, but their spouse who's concerned about these acting out dream behaviors. And so that can certainly contribute to bad sleep. Again, shift work, unfortunately, that's another thing. So not only are there behaviors that can rob us of good sleep, but there are various disorders that can rob you of good sleep. And again, with any of these things, recognizing that some of these things might be an issue, talking to your primary provider would be helpful. So what can you do? So again, you've heard a lot about the benefit of exercise. It's one of those things, if you can do it, we know it's great. It's great for your blood pressure. It's great for your heart. It's great for your brain. We know studies have shown that regular exercise, it reduces the likelihood of developing things like dementia. And it turns out it's also great for your sleep. So it's one of those things, if you can do it, it's important. Don't overdo it to cause problems, but try to maintain that exercise and active lifestyle. As I mentioned, establishing a regular pattern, not to say that, oh my goodness, it's 11:01, I better be asleep right now, not to be that regimented, but you don't want to vary your sleep by more than 30 to 60 minutes. You want to try to be mindful of, this is my, whatever time you say, 11 to 6, 11 to 7, if that's your sleep time, you should anticipate that. So starting about 10, 10:30, oh, I better start getting ready for bed and start slowing things down. And much like you remember when if you were children, when they were young, you would have this routine, oh, Johnny, it's time to go to bed. So you turn down the lights and slow things down and give him a bath and read a book and then turn out the lights and good night, Johnny. That kind of a rhythm, that slowing things down and letting our body recognize that it's going to be time to go to sleep, and trying to establish that kind of a pattern is important, so that, again, to help encourage good night's sleep. As I mentioned, how electronics and alcohol and nicotine and caffeine, all of these things can rob us of good sleep. There are studies that show even a single cup of coffee for some patients can affect how they sleep at night. And so in general, we say anything like nicotines and caffeine, in the early afternoons, but nothing in the late afternoon, and certainly nothing in the evening. Similarly, alcohol, maybe a glass of wine with dinner, but nothing after that. And watching your electronics time is important because, again, not only can it affect our light responses, but our brain in terms of it activating. So making sure you watch those, and especially for our younger patients, that seems to be a bigger issue as they're connected 24/7, it seems. But enforcing that and then showing that behavior in yourself as well, so that they can see that, oh, mom and dad are doing it too, and really emphasizing that behavior, I think, is important. And as I mentioned, maybe a short nap might be okay, but really try to avoid taking anything more than 30 minutes, so that you can, again, help encourage better sleep at night is important there as well. As I mentioned, there are many things, medications, various disorders that can also rob you of your good sleep. So if you've followed these kind of exercise and pattern, you've done these things and you still feel like you're not getting a good night's sleep, I think it's important that you talk to your primary provider about what it might be that's contributing to bad sleep and what disorders that might be unrecognized that we need to address to try to help you with that. Again, there are a few links, again, from the American Heart Association. There's again, among other things, it again talks about, again, what I'm going to call 7+ with the importance of sleep. As I mentioned, the National Institute of Health also has a very patient-friendly website that talks about importance of sleep. And then the American Academy of Sleep Medicine is one of our top sleep associations that, again, has a sleepeducation.org that's very patient-centered to kind of help patients be more aware of sleep disorders and what can be done about those. And again, I think these links will be shared with you after this meeting. So I thank you for your attention, and I think I'm happy to answer any questions that you might have.
All right. Well, thanks so much, Dr. Park. And we do have questions for the whole panel here. So hopefully you guys will help us answer some of them. Why don't I start with you right away, Dr. Park? Is it possible to catch up on sleep debt? I mean, if we're just going night after night with bad sleep, can we catch up?
Yes, so you can. And that's where I think many folks tend to do that on weekends or when they're not working. I think that's something that some patients might do. Then this is where we want to recognize that that catching up, again, it's like many things, you don't want to overdo it, because over time it turns out trying to force yourself to spend more time in bed can actually negatively impact your sleep as well. So it's trying to find that balance. And so this is where one of the, so you try to, if you feel like you're not getting enough sleep, try to increase your sleep by at least half an hour or, hour if you can. But at some point, if you feel like, oh, I'm just, spinning, you're twiddling your thumb in bed and not doing anything, then I would suggest you get out of bed. So to answer, yes, it is possible, but recognize that there's a limit to how much sleep you actually need. So be mindful of that total time.
Good advice. Good advice. Thanks. Dr. Brewer, we hear conflicting claims about eggs and heart health. Can you clear it up for us? Are eggs good for us? Are eggs bad for us?
The chicken or the egg? You're exactly right. There's been so many conflicting studies with eggs. So I would say you can eat your eggs, but in moderation. And I also recommend for my patients, instead of eating a whole egg, eat egg whites instead to help with your cholesterol. So in moderation, don't eat 3 and 4 eggs a day. Maybe just say, on the weekend, when I'm able to stay home and cook breakfast for my family, we'll have 1 egg each, and we'll tend to go to egg whites.
Good advice. Everything in moderation, right? Dr. Ekman, some data suggests that proactively taking a baby aspirin can help prevent chronic heart conditions or acute heart conditions or strokes. Is that a good idea?
That's a great question. Baby aspirin is a good tool for many people, but not all. And there are a number of factors that can help determine whether or not that would be recommended for you. It depends on your age, your other medical history. So this is not something that I can give as general advice that everyone should be on it because it may not be right for you. So this unfortunately falls into the ask your doctor if aspirin a day is right for you category.
All right, good answer. Good answer. Dr. Park, can you say anything about melatonin? It's a natural supplement, and I know lots of people use it. Is it safe? Is it a good idea?
Yeah, it's again a great question. So melatonin is a natural substance, a supplement, and so a couple words of caution because it's not FDA regulated. I generally recommend if you're going to use melatonin, I generally recommend sticking with a reputable company, perhaps made in the U.S. based on some quality control. Melatonin, I think most folks who do take it probably, so they'll use it for try to help them sleep better. And most studies suggest that melatonin is fairly benign in terms of side effects. And there are various sleep disorders that we actually recommend melatonin. But for general sleep, again, if you feel like melatonin helps you, that's fine. Where we tend to rely on melatonin is those individuals, if you're traveling different time zones and need to kind of reset your biological clock, that sometimes we'll use it for those. But if you find that you're having to depend on something to help with your sleep, it might be maybe, again, like Dr. Ekman said, might be visit your primary provider and talk about why you feel like you need to take something on a regular basis to help you with your sleep. But again, generally it seems to be safe, but just be mindful of the company that seems to provide that product.
Great, thanks so much. Dr. Brewer, we talk about Life Simple 7 as being a holistic approach to a lot of different ways to approach healthier life. But our attendees want to know if they had to start with one, if there was one risk factor that they had to start with, what do you think is the most important?
I think everyone probably knows my answer because I emphasized it a lot during the talk. I would say activity. Activity makes you feel better. It also helps with your sleep. Your sleep then improves your mood, and you're more likely to focus on the other Life Simple 7. So you want to eat healthier. You want to stop smoking because you're feeling better. So I would say, let's really focus on the activity if there were one that you really needed to. But I do want to emphasize that smoking, though, is the one thing that you can do to really reduce your risk for heart disease and stroke. So I would, first of all, start with activity for everyone. But if you smoke, let's go ahead and quit.
Great, thanks so much. Let's do one more question. Dr. Ekman, when folks are getting to monitor their blood pressure more, is there an age at which we should start monitoring ourselves more frequently?
It's a great question. you know, as you saw, and I think it was my first slide after my introduction slide, it starts to become more prevalent, certainly by the time people are in their 40s. And, you know, often we see 20 and 30-year-olds, particularly men, are often not visiting the doctor. But this is a good example of why it's so important to have a relationship with a healthcare provider and be seeing someone. And, you know, even if you're in for a sinus infection or a sprained ankle, you'll get your blood pressure measured periodically. I think by the time people are certainly in their 40s or 50s, it's worth it to be monitoring it more frequently than, you know, when you're being seen for other healthcare. Again, this is an asymptomatic thing that finding it early is important because the lifetime exposure to high blood pressure is a big part of what confers much of the risk. Many of the blood pressure cuffs, as I mentioned, are pretty inexpensive. And so it's not a bad idea to get one. You know, if you're otherwise in good health and have not had trouble with high blood pressure, you don't need to check it very often. But if you do have one, it's not a bad idea, even if it's a few times a week or, you know, once or twice a week. I often encourage my patients to get a blood pressure cuff because it can also be real helpful when you are calling your provider for advice or you have health concerns. And with more telemedicine and remote monitoring these days, given the COVID pandemic, it's also nice to be able to get that blood pressure at home. There's a reason it's considered one of the key vital signs. It's really a vital part of your health. So I think knowing your blood pressure is worthwhile at any age.
Thanks so much. And we are out of time. So I want to give a heartfelt thanks to Dr. Brewer, Dr. Ekman, Dr. Park. You're all fantastic. Thanks for spending your time and sharing your expertise with us tonight. And thanks to all of you who decided to chime in and ask some questions tonight too. We're really happy that you spent this hour with us tonight during Heart Month for our wellness webinar. So thanks very much, everybody. Good night.